We had 39 variants of concern in York region. We broke them down into households, and there are 24 households. Out of those, 6 households had acquired it from travel abroad, so they're travel associated. That tells us that the majority of the households have acquired it from local transmission. Now, when we have interviewed the individual cases, we have been very surprised in that some individuals have had very short incubation periods of 18 hours to 2 days, basically. We've interviewed the cases. The incubation periods have been very short. In one case, it was only 18 hours to 2 days. So that indicates that it's very transmissible. We only had about 15 cases last week. This week we have 39 cases. So that just shows you how fast the variants are multiplying. Now, we have actually put very strong rings around them because we actually have a unit that is concentrating only on the cases and getting in touch with the close contacts expeditiously and making sure that they are self-isolating. And of these 39 cases, 10 are active, the remainder have recovered. When we interviewed the cases, we discovered that some of them have actually not spent more than a minute or 2 minutes doing some essential shopping in places. There were the others who may have spent perhaps almost an hour shopping, but it gives us the impression that this is being transmitted very fast indeed. What we are concerned about is that many jurisdictions that have had variants have exhibited rather explosive and exponential increases in their cases. And whilst I don't think that that would necessarily be happening in York region just now, but because we have the activities at the international borders, in the border with the US, restricting the entrance of individuals with COVID-19, through testing mechanisms and quarantine mechanisms. In addition to that, we also have a stay-at-home order just now in York region. And this, I think, is helping us curb the spread. But I am concerned that if the cases were to multiply, then we could actually see quite an increase in the numbers of cases. So far, we are not seeing an increase in the numbers of COVID-19 cases, and that's good. But if we were to see a dramatic increase in the numbers of cases, then I wouldn't be too surprised if we were headed into the third wave. And that is exactly what we want to prevent. I wasn't really expecting many cases of variants of concern here in York region, so that certainly was a great surprise to us. Also, for the ones that have acquired it from abroad, it is a spectrum of countries. It is countries like Ghana, Israel, the Maldives Islands, Egypt, the UK. So that tells me that the variant is probably prevalent across many countries in the world. The speed of transmission is certainly greater because apparently the variant has a higher viral load, much faster, and it reaches higher peaks, and it appears to be there for a longer period. So that translates into a shorter incubation period, as well as higher transmission. However, in terms of the guidelines from public health, the same sort of guidelines need to be deployed. In other words, ensure that you have 2 meters physical distancing, making sure that you have masks on, going out only for essential visits. Now, remember that some of the cases that we had did precisely that and still acquired the variant. So don't go out unless it's really necessary for the moment. I think once we get the numbers down of COVID-19, that would also include the numbers of the variants going down, we should be in a much safer place. And the numbers are going down. So that's the good part, good news part. Also, of the 39 variants that we've had, only 10 of them are active at this point in time. So that again is good news. And what we have to be careful about is that if we let these variants multiply, then it causes all sorts of problems for us going forward. For example, the herd immunity that we've been aiming for is around 70% vaccination. Uh, if we have a predominance of these variants, we may have to aim for a herd immunity that might be closer to 85%, which is going to be rather difficult to achieve. And that may mean a protraction of the COVID-19 pandemic. So the price is quite high here, and we need to ensure that we take every step necessary to pull down the numbers of variants circulating. In countries where the numbers of variants have increased and there's a dominance in the numbers of variants, you have actually seen an explosion in the cases. And we want to try and prevent that from happening here in Ontario.